Hey, welcome to another episode of Clear Lake Connections, where we talk to the people behind the businesses of Bay Area Houston. Proudly sponsored by UTMB Health. Today's guest, Ben Shapley. You are the nursing program director at the Clear Lake Campus.
Yeah, program manager, yes, sir.
And that's the ER, correct?
No, so that's over trauma services. So
Okay.
we have an ER manager that covers the ER, and then I'm over trauma services, which is follows the patient through their whole stay.
And tell us about the recent designation that you guys received.
Okay. We're currently functioning as a level 2 capable trauma center. We're a level 3 verified through the state, but we're functioning as a level 2. So we're going to elevate our standards.
And so what do the different designations mean?
So there's 4 tiers of trauma designation. Level 4 would be your simple injuries, isolated injuries with a single service, so like a broken arm or a broken leg, and then anything else they would stabilize and ship out. Level 3 has trauma surgeons that will come on site and take care of the patients when they arrive. Some service lines are available not necessarily 24/7. Level 2, you have those services 24/7. So neurosurgery, vascular surgery, orthopedics are all 24/7. We have in-house trauma surgeons. So they're there within 15 minutes of a trauma patient getting there. They're at the bedside already taking care of the patient. So it just brings a lot more service lines right there to the patient.
And then the level 1?
Level 1 adds a couple other specialties, but primarily the biggest difference is their ability to do research.
Okay.
So that's the biggest differentiation.
And so are there any in our service area?
So we have Galveston. UTMB Galveston is a level 1 trauma center, and then the next closest would be the Med Center up in Houston.
Okay.
So
What are you guys typically seeing, especially right now during the flu season?
It's the ER is seeing a lot of flu, a lot of respiratory problems, and a lot of trauma now that we're level 2 capable. We're getting a lot of injuries, a lot of car accidents mostly, and old people, geriatric falls with head injuries.
And so I guess the local authorities know that you guys have this designation, and that's they send the patients that way.
Yes, sir. And we do several times a month. We're visiting with the EMS services to just let them know of all of our capabilities, and then follow up. We give them feedback on patients that they've brought into us, and we kind of review the cases, and if there's something they did right or did wrong, good catches, like, hey, great job on this one, and then they like to hear the outcomes when they did have that great catch. What did that mean to the patient? So the ER takes them in initially, and then I guess your department sees them through their stay. Is that how it works? So they come into the ER, and then as a trauma activation, and trauma surgeon will see them in the ER. They're seen there, and then we'll follow them through their whole stay. It's the trauma surgeons will be over them, and then once they're cleared from their injury, if they still need to be hospitalized for medical reasons, they might hand off to a medical team, but otherwise we keep them through the stay. Yes.
How did you get into nursing?
Way back when, we won't talk about how long ago, but the TV show ER was favorite, and I was like, that looks cool. I want to do that. So
were you an ER nurse at one point?
Yes, I've been ER pretty much my whole nursing career. Large level 1 trauma centers in Texas, or in Tennessee, and then here's Texas Children's. I was in the ER there as well. So just love the ER.
And so you're the program coordinator, director,
program manager. Yes.
Manager. So you're in charge of all of the nurses within the trauma services?
No, so I'm over. Mostly what we do is chart audits and make sure we have all the things in place that we need for the trauma patients. The ER managers, and then each unit in the hospital has their own manager that they're over the nurses, but we make sure that the big picture of the patient care is followed, and we're meeting all the standards that we have to for trauma.
So how did you come to UTMB?
By chance. They had a pediatric ER that they had a spot open up, and a friend of mine said, hey, you should come check this out. And fell in love with it.
Yeah, speak about the culture, because it's almost everybody that I've talked to from UTMB, they can point to the culture and the environment as one of the things they love about it.
It's great. It's real friendly. It's good teamwork. We have a lot of close teamwork, and everybody's willing to help everybody out. So everywhere from just the lowest level to the highest level, everybody works great together, and everybody, doesn't matter who you are, everybody's willing to help everybody else out. So.
Yeah, and we were talking before about how through this podcast, a lot of us have switched over to using UTMB services,
right.
And we can notice that everybody just seems happy at what they're doing.
Exactly, it is. It's amazing how just it is a family, and like you said, everybody, you come in and you get one provider, but then if you need other services, they're like, oh, we'll give you this provider. We got this provider. They'll get you in touch with who you need to be with, and just make it smooth, nice, seamless transition to each service line.
Now, we always hear about in the media about the nursing shortage, mm-hmm. and at crisis levels. How are you guys? Are you being able to staff it fully, or are you experiencing the same thing?
Yes, staffing's actually pretty good. They've constantly doing hiring events and have hiring staff, and we are pretty much fully staffed.
Well, I think it probably also helps that you guys also teach the nurses, and
right.
You have this supply, your own. You have your own supply to help meet that demand.
Exactly, it's great. We have services or schools that'll come in for clinicals, and so they get that. Those nurses or student nurses are building that relationship with the team, and a lot of those nurses end up getting hired on. So it's really smooth transition for them.
Well, that's great.
Mm-hmm.
Anything else you want to tell us about the Clear Lake Campus ER and the services?
Sure. Well, like I said, we are level 2 capable for trauma. We're a stroke center, primary plus stroke center, so we can take care of all the different kinds of strokes, and we have the neurosurgery teams in place to take care of any kind of stroke. We're the only pediatric ER in the area, so that's phenomenal. And our peds team is great. They're really great. And then it's just every other ER that I've ever been to and worked at, there's always a wait, and it's not uncommon to have long waits to get back to a room. But at our campus, patients get back quick. There's very minimal waits usually. So that's a huge thing for patient satisfaction, just knowing that they're not going to be sitting there forever. We get you back, get you seen by a doctor right away. And
what's the secret?
Can't tell.
Because you're right. ER waits can be.
Yeah, it can be painful.
I learned a good trick. If no matter what you go in with, if you have chest pains, you get back right away.
You get back quick. Yeah.
I found that out the hard way when I had pleurisy.
Right.
I thought, you guys are taking really good care of me. So we've talked about overcrowding at a lot of the ERs. Right. Talk to us about when people should probably skip the ER and go to urgent care instead.
Okay, so for urgent care would be most of your mild to moderate symptoms, anything that's fever but just not feeling good, or if you're just wanting a flu or RSV test or COVID test. Those are all things that could be handled by urgent care. Minor injuries can typically be handled at urgent care. Any of your more moderate to severe injuries, or besides a minor cut, anything involving bleeding should definitely be ER. Any change in mental status should go to the ER. Trouble breathing, of course, you want to go to the ER. But mostly urgent care is mild symptoms and things that if you could wait till the next day, that should go to urgent care.
Okay. Yeah. So you mentioned that you're the only pediatric ER in the area. Obviously, that's a huge benefit to our community. Talk to us about what that actually does bring to us.
Okay, so that brings first of all shorter wait times that we've talked about, because you're not serving such a huge area like the med center, but we have pediatric ER that's taking care of these sicker kids versus going to urgent care. We get to see those. We're getting them treatment right away. They're not having to travel. We're seeing a lot of respiratory problems right now, and we're able to take care of those. And it's preventing kids by having the ER close to home, people don't wait as long to go into the ER versus knowing that they're going to have to go either down to Galveston or up to the med center and have that long wait time. They'll come to us knowing that they can get seen quicker. It's not going to be an all day event. So it really helps them from having to be hospitalized for their
and it's 24/7, right?
We're seeing pediatric patients 24/7.
Yeah.
We have 16 hours of pediatrician coverage.
Okay. Because I remember when my kids were young, they never picked the daytime to
No, it's
to
always
need an
always
ER.
evenings and
Yeah.
middle of the night. Yep. Wake up with the ear infection or fever and vomiting and yeah.
So what's driving all this traffic for the respiratory issues?
I think a lot of it had to do with COVID. You had those times where everybody was isolated, so nobody was having contact with anybody. But now all the kids are going and playing, and it's just a lot of the regular respiratory illnesses, but that these kids haven't been exposed to previously. So that's why it's such high numbers of illness, and seeing a lot of RSV, and it's that time of year, flu symptoms as well, and then just cough and congestion. But it's just bad.
And there's nothing worse than not being able to breathe.
Right. Yeah, it's kind of important.
Especially for kids.
It's one of those things.
Yeah, scary stuff. So we talked about how the patient gets admitted into the ER, and then if they stay, your team takes over.
Right.
What's the benefit of splitting it up like that?
So they come in, first of all, it frees up the ER physician to see the other patients in the ER. But it also then, if we have a severely injured patient, our team's there right away when the patient gets there, especially if they're coming in by EMS. We get a call that they're coming. So we're there at the bedside ready, waiting before the patient even gets there. So the doctor's there ready. Depending on what the injuries are, the doctor may look at them and know we're going to OR. And within 10 minutes of arriving to the hospital, they're already in the OR getting operated on as necessary. We have 24/7 operating rooms available for our trauma patients, and they can get in there. Like I said, they get in there within 15 minutes. They're in the OR as necessary. And then our team will follow them through their stay so that they can see the changes. And typically it's the same doctor several days in a row. So they'll see changes and be able to pick up on that a lot better than if you have multiple handoffs or different teams taking care of the patient. So it really, that continuity of care through the whole stay really helps the patient and helps pick up on those any complications that may be happening.
Yeah, and it also helps the patient because they're seeing the same people.
Right.
And,
they get more comfortable.
Rapport.
They can tell them, yep, I'm feeling better than yesterday. No, I'm not feeling better. It feels different. The person they're talking to is going to know what they mean.
Yeah.
So as a level 2 trauma center, the patients need to be admitted to a surgical service. So that's kind of a standard that we're meeting for trauma. Some of the hospitals, not necessarily, they might admit those patients to a hospitalist or an inpatient team, and then the trauma surgeon may just work as a consult, kind of like just once in a while peek in on you.
Yeah, I think the model is fairly unique from what I've experienced. With my mom being in the hospital, and my brother broke his back, and there's never the consistency that it sounds like you guys provide.
Yeah, it is. It's really great, and then you can see just how it impacts a patient, being able to have that comfort. They build up a rapport with the doctors and even the nurses, having those same people take care of them. It really helps.
Yeah,
it's comforting to know that you're there with somebody that cares and that they know what's going on with you versus a stranger coming in every day.
No, it's a great model. So you brought up the relationship that you have with the EMS, the local EMS, and tell me a little bit more about how that relationship was born.
Sure. We have a EMS outreach liaison, Richard Arocho, and we go out with him to the multiple service lines, EMS services that bring us patients. We go pretty regularly and visit. He's always in their face, talking to them, just have that FaceTime and build comfort with them. We go over cases that we've had, give the feedback on the case, but we also are always updating them on all the services we have available, everything that we can do for the patients. And they really, having that relationship, they really get comfortable with coming to us. And then we make them a priority when they do come in. So we make sure that they're not just there standing waiting for a bed. We will put them in a bed quickly because some places, unfortunately, EMS just is on the sidelines and they end up waiting, and they're the priority. We want to get them in a bed right away, so because they need to be back in service,
Yeah.
and we need to make them a priority.
Sounds awesome.
Mm-hmm.